Hi, my name is Vimala Ramachandran. I'm an orthopedic hand surgeon at Ortho Arizona, and today we're going to talk about de Quervain's tendinitis. So de Quervain's tendinitis is a tendinopathy or tendinitis of the first dorsal compartment of the wrist, meaning there's two tendons right here at the level of the wrist, right here, that go to your thumb. And if you zoom in here, you can see that when I abduct my thumb, you can see two actual tendons. They go through a tunnel right here, and that tunnel, with use, repetitive use or a trauma or an injury, instead of being nice and wide, becomes thickened and narrower, and that does not allow the tendon to glide freely through the tunnel, causing it to get tight and cause pain, which is what de Quervain's tendinitis is. Predominantly, de Quervain's tendinitis is a overuse or repetitive use injury. So anything that's going to cause you to go back and forth like this, or just honestly activity over time, just growing up can cause it. We oftentimes see it in young mothers because they're constantly lifting their children like this, causing this motion, and it again causes inflammation in those tendons and causes that tunnel to narrow down. It is more common in women than in men. And it predominantly affects people in their 40s and older. De Quervain's tendinitis is diagnosed on clinical exam. We usually have to differentiate between that. If there's been an injury, we always want to make sure that there's not a fracture, or since it's oftentimes seen in patients who are older, 40s, 50s, we have to differentiate between that and arthritis. We will also get x-rays if we're concerned about arthritis being in that differential, so that will also help us diagnose de Quervain's. The literature shows that splinting and resting using anti-inflammatories usually has about a 14 to 15% or 16% success rate. Steroid injections actually are probably the mainstay of treatment, as they have up to about an 80% success rate on their own and helps resolve the symptoms. The other 20% end up needing to have surgery. Surgery in itself has about a 90 to 95% success rate. Surgery entails making an incision on the wrist. I typically will make a small incision about this big, maybe about ½ inch in size, directly over that tunnel. We go down to that level of the tunnel, and we just make a little slit in the tunnel. So the tunnel literally looks like a circle like this, and we go in there with a knife, just cut a slit in it, it opens up, and that frees up the tendons, allowing them to glide freely. After surgery, you're typically in a dressing that goes from the tip of the thumb to about mid-forearm, for about 10 days. The fingers are free and you're allowed to use your fingers, but we try to rest the thumb for about 10 days until the incision's healed. Once the incision's healed, we take the sutures out and let you start using it. Most people do not need therapy. Occasionally I see people who are very stiff after surgery, and I will send them to therapy for about a month. Most people are back to all their activities within 6 weeks of surgery.